I'm Julie Barkey with this Senate update. Minnesota is on track to establish an ABLE account. ABLE stands for Achieving a Better Life Experience, and what this legislation would do would provide a special financial account for families who have special needs children or adults. So for details, here's Monday's testimony from the Health, Human Services, and Housing Committee.
And also, I want to thank, first of all, Liam Moynihan for your hard work on this, and also Senator Nelson, who also had a companion bill that was there. It's the same language, but it really, we're working on it to get, at the end of the day, a good product. So on December 19th, 2014, after many years of bipartisan advocacy in the U.S. Senate and House, the ABLE Act became law. This federal action has paved the way for states to enact our own ABLE Act, and this is what we want to do here in Minnesota. We're going to allow eligible individuals with disability the ability to establish the Minnesota Achieving a Better Life Experience accounts for their qualified beneficiaries, and that resemble the qualified tuition programs, also known as the 529 accounts. Those have been established under the tax code since 1996. The new ABLE accounts will allow more individual choice and control over spending on qualified disabilities expenses and limited investment decisions. And it really is the level of the playing field. It starts us in the right direction. And so in reference of time, I promised you I would speak no more than 10 minutes. I'm going to pause and have my ending statements and allow Mr. Steve Larson to comment about what the ABLE Act means here in Minnesota. And you should have some handouts, members, from ARC Minnesota that should be within your packet. So,
we do.
Madam
Thank
Chair.
you. We have a handout from the ARC. Mr. Larson, would you like to introduce yourself and begin your testimony?
Madam Chair, I'm Steve Larson with the ARC Minnesota and committee members. We're really excited in the disability community about what's going to happen in 2015 at the Minnesota State Legislature. Beginning with the passage in this committee of hopefully Senate File 39, the ABLE Act. Along with this, we are working on the MA income and asset standards, and we just think that this is a golden opportunity for Minnesota to take some bold steps forward to help individuals with disabilities not have to remain completely in poverty in order to access public supports. In Minnesota, over 100,000 individuals with disabilities and their families depend on a wide variety of public benefits for income, health care, and food and housing assistance. Eligibility for these benefits, such as SSI, SNAP, Medicaid, require meeting a means or a resource test that limits eligibility to individuals to report no more than $2,000 in cash savings, retirement funds, and other items of significant value. To remain eligible for these public benefits, an individual must remain poor. For the first time in public policy, the ABLE Act recognizes the extra and significant costs of living with a disability. These include costs related to raising a child with significant disabilities or a working age adult with disabilities, for accessible housing, transportation, personal assistance services, assistive technology, health care not covered by insurance, Medicaid, or Medicare. ABLE accounts will take our tax advantage savings accounts for individuals with disabilities and their families. Contributions to the accounts may be made by any person, the account beneficiary, family, and friends, and would not be tax deductible. Each state is responsible for establishing and operating an ABLE program. The Secretary of the Department of Treasury will begin to develop regulations that will guide the states in the terms of the information required to be presented to an open and ABLE account, the documentation needed to meet the requirements of an ABLE account eligibility for a person with disability, and the definition details of a qualified disability expenses, and that documentation will be needed for tax reporting. The Secretary is required to have that done in the next 6 months. An ABLE account will provide more choice and control for the beneficiary and family. With an ABLE account, account owners will have the ability to control their funds, and if circumstances change, still have other options available to them. Thank you for your support of the ABLE Act.
Thank you very much, Mr. Larson. Are there any questions for our testifiers on the bill at this time? Seeing none, did you say you wanted to make, oh, I'm sorry, Senator Laurie.
That's right. Thank you, Madam Chair. Senator Hoffman, just curious, there's a lot of different agencies that could take the lead on monitoring the accounts. do you know if DHS has a position on whether they're the right one, or is there another agency that might be better suited to hold the account? And do you have more committee stops to entertain that question? Because somebody's going to have to take on the administrative, some agency's going to have to take on the administrative job of monitoring these accounts, and I'm just wondering if you're solid where you're at right now.
Senator Hoffman.
Madam Chair and Senator Laurie, yeah, that conversation actually came up 2 weeks ago in my office with the Department of Human Services, and then Mr. Moynihan was there. And originally, you know, when we set this up, and I want to thank Senator Ann Rest, really is the one who brought this to our attention here in Minnesota, and she's here right now from our tax folks. It made sense originally to have DHS. However, 529 is in the Office of Higher Education. And you look at states like Massachusetts. Massachusetts took it from their children and youth special health care needs, Ron Benham's world, and they threw it up into the Office of Higher Ed. So still that question remains out there. I'd asked them to go back and talk to, you know, where it made the most sense. I'm wide open. I think it makes the most sense to keep it in the higher education side of it, but there's going to have to be some technical assistance that goes in there about how to be flexible, because it's not just constricted to, you know, the college savings plan, but it's beyond that. So absolutely, Senator Laurie, I'm still open to that.
Thank you. Did you want to continue,
Thank you.
Senator
Just
Laurie?
a follow-up comment. I should have prefaced it with very supportive of where you're going with this. Just want to make sure that the mechanics is in the right place.
Yeah, thank you. I see Senator Rest is here. We would invite you, Senator, to speak to this if you would like to.
How could I resist? I do appreciate the leadership of Senator Hoffman on this bill and the warm reception that it has received from the co-sponsors on it. I was, you know, it's one of those things where we get so down on the federal government, but this effort at the federal level was extremely bipartisan. It passed the House without even a recorded vote. It was so popular, and just sometimes things come along where it becomes obvious what the right thing to do is to benefit our families. And I'm just happy that it's receiving a warm and bipartisan reception here, and I think it's going to make a huge difference in the lives of many, many people in the years to come. So I'm just feel privileged to be part of it.
Thank you. I see that there is a question, Senator Rosen, or Senator Nelson, excuse me.
Thank you, Madam Chair. Not so much a question, just a comment, and maybe a comment to Senator Laurie's question as well. First, let me just say that this is a great bill, and I really appreciate Senator Rest and Senator Hoffman taking the lead on this. I was following this also as it went through the Congress, and actually was working on it early in December before it passed. And so now it's exciting to see actually the references that I had in my legislation actually now have a reference to federal legislation that has been passed for this. So very important. Let me just tell you why I was so interested in following this. Well, my background's in special ed. I'm a special educator and the daughter of a special educator. But what I've seen in my community is parents who have high needs children are extremely worried. They've been able to care for their children in their home. Now these children are adult children, still with great special needs, but the parents are significantly worried about what's going to happen to these children when the parents die, and the children then would not have the funds to continue care. And so this is an incredibly important step towards that, and it is nice that we can say that the feds did it, and we can too.